I am Dr. Jean Fourie. In this video, I present a checklist for early childhood and primary school and remedial teachers to use in screening children's visual and auditory perception skills. The first part of the checklist focuses on vision and the second part on auditory perception. This checklist is completed for each child individually and could be done over one or a few days. Should the teacher be concerned about any items of difficulty raised in the screening checklist, then the child should be referred to a medical practitioner for further assessment and interventions. In Part 1, record whether any visual impairments are present in one or in both eyes. Having a visual impairment would influence perception and might make further parts of this checklist invalid. Some impairments like squint, blindness, cataracts, or deformities could be easily observed, but most visual impairments are not observable, and so teachers should speak to the child's parents if any difficulties are suspected. If the child has been previously diagnosed with a visual impairment by an optometrist or a medical practitioner, then this can be recorded on the observation checklist, so teachers know how to assist the child in the classroom. In Part 2, observe and record the general health of the child's eyes. These are symptomatic indicators of possible infections or conditions that require further medical intervention. Observe and record if there is excessive blinking, very dry eyes, the white of the eye is bloodshot, eyes are red, itchy, watery, and inflamed. The eyelids could be swollen or pussy with the lashes sticking together. You might be able to observe if the pupils of the eyes do not react to light changes. The pupils should be small or closed in bright light, and large and open or dilated in dim light. If any of these are observed, then immediate referral to a medical practitioner should be made. Part 3 pertains to errors of refraction in the child's visual system. Record whether the child wears glasses or contact lenses. Note whether the child is far-sighted, where close or near objects are blurred, or is the child near-sighted, objects far away are blurred. It is useful for the teacher to know when the child should be wearing spectacles in the classroom for desk work and seeing the chalkboard. Part 4 records whether there are any obvious difficulties with eye movements. Ask the child to look up at the ceiling, down at the floor, to an object on their left side and an object on the right side. Ask the child to look at a close object like a picture in a book and a distant object like writing on the chalkboard. Note whether there are any jerky, erratic eye movements or if the eyes move independently of each other. In Part 5, record any verbal complaints the child might express, which could be indicative of visual difficulties. The child could complain of headaches when reading or writing, feeling dizzy or unwell after reading, could complain of eye pain or seeing double, or say that the words move or float on the page, or of not being able to see well, or the child could ask to sit closer to the chalkboard. In Part 6, observe and record any social indicators of possible visual difficulties. There might be obvious signs that the child has difficulties when trying to follow other speakers' facial expressions and gestures, or when starting and following conversations, or even trying to organize their classroom materials, finding their school books, and stationery in their school bag. In Part 7, observe and record if the child can identify colors. Ask the child to pick out different colored pencils or crayons or colors from a variety presented. Check that the child knows this list of the main colors: red, yellow, blue, green, pink, orange, purple, white, black, gold, silver. Make a note if there is a formal diagnosis from an optometrist if the child is colorblind, and which color combinations does the child have difficulty seeing. In Part 8, observe the child reading a book aloud. Look for the following signs that might indicate visual difficulties. Poor eye tracking of words on the page could be seen if the child loses their place while reading, or skips words, or jumps and reads from the line above or below the actual reading line. Note if the head is unnaturally tilted or very close to the page, or if the child closes or covers one eye when reading. Observe if the child confuses similar looking letters and numbers when reading and writing, such as P, G, B, D, 890, XV, 1 and 7. Is the child able to read grade appropriate books without tiring too quickly? In Part 9, observe the child writing some classwork in their school books. Look for the following signs, which might be indicators of visual difficulties. The pencil is held very tightly when writing. Lines are drawn very boldly and overemphasized. Difficulty writing in a straight line. The head is tilted or very close to the paper when reading or writing. Miscopies from the chalkboard. Drawings are poorly orientated. Excessive frowning and squinting when looking at the board. Difficulty working quickly between the board and the desk, consistent postural difficulties, excessive use of the hand or finger to keep a place while writing, writes crookedly, poor spacing, does not stay on the lines, leaves out letters, numbers, or words in writing, rubs the eyes even after short periods of written work, and appears to daydream and is excessively inattentive. In Part 10, observe and record any physical activity signs which could be indicative of visual difficulties. The child looks carefully at the ground while walking and places footsteps very deliberately, often falls accidentally while running and playing, has difficulty catching, hitting, or kicking a ball, avoids physical activities, rough play and sport, has difficulties with eye-hand coordination in catching a ball, difficulty with writing for a normal period in class, has difficulty with precision work, such as cutting and pasting tasks. In this section of the screening checklist, the child's auditory perception skills are observed. Start by noting any auditory impairments in one or both ears, which have been reported regarding the hearing loss. Note if the child uses a hearing aid. Having an auditory impairment would influence perception and might make further parts of this checklist invalid. Auditory impairments are not easily observed. If the child has been previously diagnosed with an auditory impairment by a medical practitioner, then this can be recorded on the observation checklist. In Part 2, observe and record any signs of difficulties with ear health in one or both ears. Does the child rub the ears frequently? Does the child have frequent colds or runny noses? Is there a history of ear infections or an indication of the child having had grommets inserted previously? In Part 3, observe signs of speech, which could indicate auditory difficulties. Note whether the child speaks excessively loudly or softly, Does the child speak in a monotonous, expressionless voice, or too slowly and deliberately carefully? In part 4, observe any signs of language learning that may indicate auditory difficulties. Record how many languages the child speaks. Is the child's home language spoken fluently or hesitantly? Can the child speak and understand the language of learning and teaching, which might be different from their home language? In part 5, observe the oral language spoken by the child, which might have indicators of auditory difficulties. Does the child have difficulty remembering vocabulary terms, difficulty discriminating or clearly articulating similar sounds, such as p, b, or m, n, ng, and k, g, and sh, s? Does the child have difficulty discriminating or producing similar sounding words, such as mad, man, dim, din, or leg, led? In part 6, observe and record any social indicators of auditory difficulties. Does the child withdraw from social conversations frequently? Have difficulty following fast-paced conversations? Does the child need to see the speaker's face when being spoken to, and does not respond to spoken languages, particularly when the child cannot see the speaker's face and lips? Does the child misinterpret the teacher's instructions and have difficulty following what the teacher says in a noisy? In part 7, observe and record physical activities that are indicators of auditory difficulties. Does the child turn their head to one side when listening and seem to have difficulty locating the source of a sound? Does the child sometimes not hear the school bell? Does the child turn up the volume of the radio, TV, or cell phone too loudly? Does the child often become restless, frustrated, and disruptive in classrooms and appear inattentive and daydream, speak frequently as though they are in their own little world? Once the teacher has concluded the sensory screening checklist, and if there are any items that raise a cause for concern about the child's visual or auditory perception, the teacher should consult with the school remedial or support teacher, who would assist with contacting the parents and advising on any further referrals for attention. Visual difficulties are referred to an optometrist, and auditory difficulties are referred to a speech therapist or audiologist for further interventions. In conclusion, teachers' keen observations of children's development is crucial for implementing early interventions to assist children to achieve their full educational potential.